I just read today a tweet by a doctor, and he was describing that he had just one ventilator available, and he had 8 patients who were eligible and waiting for that ventilator bed to be available. And he had to make that difficult choice of who of those 8 to choose to put onto the ventilator. That's the kind of obviously moral dilemmas, but also clinical decisions which medical providers are having to take. India specifically has had weaknesses, obviously, in its health system. Though it is one of the largest health systems of the world, it's also not the case that there's been enough and adequate investment in health systems over the year. Now, when you layer on a pandemic on top of that, then it becomes extremely challenging, certainly. What has happened in the interim is that we had at least around 2 to 3 months, slightly more probably, of time when the cases started to go down. So you had a window of opportunity when a lot of reform in the health system could have happened. We could have prepared for the possibility of a second surge. We could have added more facilities, gotten more staff involved, ensured that we had adequate supplies as required for a potentially second larger wave. Last year, I think one of the challenges from a healthcare perspective was that there was an overt focus on COVID-19. So a lot of facilities which would offer general care, non-COVID care, including cancer care, dialysis, etc., were converted into COVID-only facilities. Frontline workers are really struggling. It's extremely difficult for them. There is a lot of stress. They are also faced with fairly difficult choices to make. There are challenges with being able to provide good quality care because of shortage of resources, shortage of staff. The fact that they are not able to help any of their patients is clearly troubling them. Unless the cases start going down, I think this is going to also have again, a negative impact on their mental health and well-being. So there's certainly an urgency of having to respond to the requirement of patients who require critical care. So a lot of patients, for example, who have gone into a severe form of disease require immediate oxygenated beds or ICU beds or ventilators, etc. That requires a lot of probably step-down facilities to be created where they can be managed, and only those who really need should be referred up to tertiary care facilities where you might have more advanced care available. We need to ensure that we have a secure supply chain for all medical supplies, especially basic ones like oxygen. We need to obviously ramp up our vaccination strategy so that more and more people can get vaccinated as early as possible. And we also need to decrease the load on the health system through mechanisms such as lockdowns. Now, limited lockdowns are already happening in many parts of India, but perhaps we need a more larger lockdown covering most of India or all of India, so that physical distancing can be imposed, less social interactions, and that hopefully will decrease the number of cases over the next couple of weeks.